It is heartwarming that the NUC appears to be tackling the menace of fake universities frontally. But there are many questions begging for answers. What type of investigation is the National University Commission conducting? Universities are not daycare centers. How did this university degree mills start off? Is there a cabal behind the fake universities? Are there no regulations or requirements before universities are accredited? Did the NUC accredit universities? And what are these investigations? Please, can you explain? This one is coming from one Mr. Charles Nzeku from Delta State. Another one is saying, what is the true position about the crisis at the University of Abuja regarding accreditation for some courses and placements of students in other universities to complete their school? Again, why has the white paper on the visitation panel to the university yet to be released? This is from a concerned parent. His name is John Owolabi from Abuja. Then another one from Leop Pajok from Abuja. Leop is asking, is the Minister of Education aware that students who have errors in their JAMB results are being charged 10,000 naira to about 100,000 just to check JAMB's error? Why won't JAMB and their staff do their work by attending to students with complaints about their results, e.g., a student who registered and sat for French, having English literature in his or place of JAMB result, or in place of French. My son is a victim of this and yet to be attended to. Please prefer answers to this. And to the Minister of Health, you are quoted to have said that there will be no need for medical treatment abroad. Sir, why? This is coming from one Isa Umoru from Ida. Then another question for Minister of Health is saying that, Honorable Minister, you claim that no doctor can say he graduated from medical school and cannot be said to be gainfully employed. But, Honorable Minister, there are a number of doctors who are qualified and not gainfully employed. What do you have to say? Dr. Mike Samari from Kaduna. Still for the Minister of Health, this one is saying, in several countries, diabetic drugs and treatment are subsidized or free. And now, so many Nigerians are becoming diabetic. Why is it that Nigerian government cannot make diabetic medication in this country free? Then this one is coming from Alkali Joseph from Takum in Taraba State. He's saying, if Nigeria attains a universal health insurance coverage, this government will have been said to do well in the health sector. Honorable Minister of Health, my advice to this administration is to ensure universal health insurance coverage before it leaves. And Professor Chukwu, please do something before you leave this government. Thank you. The next other one is saying, Is the Nigerian government doing anything about cancer, one of the world's deadliest diseases? This one is coming from Mr. Onibenga from Abeokuta in Ogun State. And another one coming from Lagos, and this one from Aniba Batayo, a concerned parent. He is saying, Honorable Minister of Health, what is really happening at the Lagos University Teaching Hospital? Patients are suffering, particularly sick children, because there is always complaint of lack of bed space for patients in this hospital when it comes to admission. Please look into this matter. And finally from me, this one is coming from Jolbam Shehu from Lagos. He's saying that the VAMED projects where hospitals are supposed to be equipped, VAMED projects, what is the position of this project? Please, Honorable Minister, explain. Yeah, Ahmed will take the other sets of questions. Thank you.
Let's go quickly here. What is the federal government doing about the national health insurance for members of the National Youth Service Corps that have stopped since this year by SMS? From Ngozi Okechukwu in Lome, Togo, via email. Honorable Minister of Health, where in Nigeria can I get treatment for swollen thyroid gland? Then another question here for the Minister of Education. Greetings to you, Ma. How will you resolve issues of discrimination between HND holders and BSc holders in Nigeria? From Bamisai Michael. Question for the Minister of Education. Professor, in spite of the efforts you have been making in the past 2 years to create more access to quality and functional education, the United Nations recently released a report that Nigeria has the highest number of children out of school in the world. Can you give us a time frame within which this problem can be addressed? From Dr. Usman Baraka in Zaria. From Abdul Hamid Jafaru in Jigawa via SMS. A few days ago, a Jigawa Chief Magistrate Court convicted and sentenced to 2 months in prison without option of fine one Professor Kolo for sexually harassing a married woman who was his master's degree student from Jigawa State. What is the NUC doing to secure his conviction? And let me take this final one so that the minister can respond. From Kamila Yusuf in Ukraine. Kamila Yusuf in Ukraine via email. Education Minister, why are some business outfits and schools discriminating against certificates issued by Nigerian schools? We must begin to discriminate certificates from such countries. An eye for an eye. Thank you.
Well, I think the question on Professor Kolo is what is the NUC going to do after the man has served his term? Thank you. Well, final question for Honorable Minister of Information. Somebody is asking here, what are you doing on ads, on adverts, on traditional medicine coming up regularly on the nation's broadcast network? They need an explanation from you. So, distinguished guests, ladies and gentlemen, the floor is now open, and I will take 2 questions.
Not been well tested. Investigation has shown this. So I want to know, what is the Honorable Minister doing in complementing the effort of the local government and state government in making sure that the quality of this education is still well assured? Thank you.
Thank you. Well, in the middle here, yes, the madam in red. Yes, the man with the red cap. Sorry.
Your name, sir?
My name is Godi Edoziem, a senior citizen. My question goes to the Honorable Minister, Education Minister, State. As a concerned citizen, I have a concern and worry for University of Abuja. We are all aware that the Federal Capital Territory is one of the best places you can be, and it is expected that the university in it must also be one of the best universities. I thought that University of Abuja will be a model for other universities. Unfortunately, my heart bleeds each time I go to the university for one thing or the other. My question, ma'am and sir, where did we go wrong in the first place? Because if you have missed out the concept, you've missed out everything. I need to find out where we went wrong.
Thank you.
University of Abuja.
Okay, the one this way. Anyone here? No?
I'm directing my question to the Honorable Minister of Education. There is something called National Vocational Qualification Framework. When is it to be implemented? Then secondly, we've all been talking about Al-Majiri education. You see, but I believe that there should be population control. I know in some parts of this country, people give birth to, one person giving birth to 50 children. I think something should be done about this. What are you doing?
Thank you. Next and the last.
My name is Obede Mike. I have these two questions from the Honorable Minister of Education and the Honorable Minister of Health. Actually, I'm a
Attention, please.
Okay, the question. So, actually, this question goes to the Minister of Health.
Can you start all over, please? Start all over.
My name is Obede Mike from the Department of Parasitology. I have these two questions, one from the Honorable Minister of Education and Health. The question for the Honorable Minister of Health, we know that this disease abides in the rural community, like the strongyloides, the ochiocytosis, and other parasitic diseases. So, but we conducted so many researches, and we have so many information at our disposal, but we don't really know who to talk to, where to channel all these research findings. So what is the position of the Ministry of Health in harnessing these research findings to alarming these people of what is going on? So actually, the second question goes to the Minister of Education. We Nigerian students, we don't believe on the classroom capacity, and we think that cannot help national development. We need to translate our educational acquired facts over time, solving practical national problems. What is your ministry doing, sensitizing the Nigerian university students of how to actually, look inward of what they can do to them with themselves, with the knowledge they've acquired over time in solving national issues?
Okay, thank you. So, distinguished guests, ladies and gentlemen, permit me now to invite the honorable ministers to answer the questions that have been raised, and we will start with the Honorable Minister of Health, Professor Onyebuchi Chukwu, to please come forward and answer his questions.
I thank all those that have asked questions. Medical treatment abroad. The only time that there will be a real reason for you to go abroad is when a particular problem you have, health problem, requires a skill which nobody in Nigeria has, or the treatment involves some facilities that are not available. There's no country in the world that has everything, no single one. So every country will provide most of the needs. But what we are saying is that if things are proper, probably you only require less than 1% need to go abroad. There are 3 things in Nigeria we don't have. And those ones, once you need them, obviously you have to go outside the country. But what we are saying is that for the majority of the people, what you have is available in Nigeria. And let me say that it's not only government hospitals, even private hospitals. Let me give you an example, because it's good to start with something you can easily verify. I don't know where you are asking from, but if you were in Abuja, for instance, and you want to do laser surgery, if you have what is called kidney stone, before, and even up till now, some hospitals, to do kidney stones, we have to open you up and retract the kidney physically. Now, even in Abuja here, there are private hospitals, it's laser. They use laser. I've sent people there and they've done it. It's not, I'm not telling you what have not been done. Or you have need for laser surgery in the eye. Even within Abuja here, you can do laser surgery in the eye. Even within Abuja here, there's no kind of cataract surgery you cannot do. So what we are saying is that it's up to you. It is like every other thing in life. Why do some people like imported rice when we are growing our own local rice? The option is yours. If you have your money, you can go outside the country and buy. The same thing with health. If you have your money and your doctor is in New York, you may go there and have your treatment, but you don't have to go there. That's the point we are making. And we're also saying that some people are unscrupulous now because they get up to 1/5 of the money you are charged abroad. They refer you abroad. They are getting that money here for doing nothing. So if you like to be swindled, that is also up to you. Then I'm also saying that some people go outside the country because they don't know. I'm happy someone asked here, where can I go for treatment when I have a swollen thyroid gland? It's called goiter. When you have an enlarged thyroid gland, this is a gland in front of your neck. It's called goiter. Many hospitals can do it, but let me say, all federal teaching hospitals, all FMCs can do that surgery. So I don't know where you are. If I knew, I would tell you the nearest federal government hospital. But many private hospitals can also do it. So that one is not the kind of thing we are talking now. There's no reason, absolutely no reason for anybody to leave this country to do surgery of an enlarged thyroid gland. There's absolutely no reason. Then doctors and employment. Let me tell you something about employment. You want to work in Abuja. How many hospitals do we have in Abuja? Everybody would like to be in Abuja. If you are ready today and you want to go to something like FMC Nguru, there's work. Oh. If you want to go to University of Medical Teaching Hospital, there's work. If you want to go to Ahmadu Bello University Hospital, there's work. What I'm saying is that there's work. Then federal government cannot employ all doctors. State governments, I still see in paper, state governments are requesting doctors to come, let's employ you. But you have your fundamental human right. If you are insisting you must work in Lagos, you've already narrowed your choice. If you say you must work in Port Harcourt, you have narrowed your choice. If you say you must work in Lokoja, you have narrowed your choice. Then finally, why did you go to school to get education? Did you go to school to be a slave? The idea of education, I know the ministers in education will concur with me, is to make you to be able to provide service. As I am now, if I'm not minister, I don't even have to work for anybody. I just open a place and I'll be treating. There's more than enough people to treat. Like I said, there will always be sickness in this world. So the customers are there, ready, waiting. So why can't those doctors, if they have gotten their full registration, why can't they go and open up? People are just simply lazy. People are simply lazy. So that person who is looking for a job is either because he's looking for a particular kind of place to work in, or is not ready to work yet. I'm telling you that on good information. Everybody would like to be in Abuja. Why can't you help people in the rural area? You're saying the minister is not helping people in the rural area. How will he do it? If when you are produced, you are refused to go to the rural area. Those people who don't have a job, tell them to go to their hometown and work. If they open any clinic there, they will make all their money there. You can see how other people do things. When they learn a trade, when a mechanic learns a trade, he opens a place and cars will come there if you are good. So if you are a doctor and you ask that question, I think you come and see me in the office. Diabetic drugs. Actually, the policy now, please, I hope people should tell our CM this, but I know a number of hospitals that are implementing the policy of the Federal Ministry of Health, We issued a policy statement for now because we have to do things that we can afford. What has killed this country before is that we were hanging our aspirations, what we couldn't sustain. We must begin to do things properly like the president said. So we are taking things in stages. Right now, the policy of the federal government is that for children who are diabetic, they get their insulin free in all our hospitals. So I'm telling you, if some CMDs are not implementing it, tell them, I'm sure they are watching TV, that is the policy we put in black and white on paper, secular. For children with diabetes, federal government hospitals are providing the insulin free of charge. We have started with that. But the ultimate thing is insurance. Insurance. We have reviewed the package for insurance. We're increasing a lot of things. Even the number of dialysis you can have on insurance, we have recently increased it. So that is the basic thing. Go and have your insurance so you'll be treated free for diabetes. Then universal insurance coverage. The president will very soon hold a presidential summit on universal coverage. That's the answer. So we're working on it, and I've already told you many things we've done along those lines. Cancer. What is being done? A lot. I told you about the law, the bill for tobacco. Prevention first. We have also started giving our girls the vaccine for cancer of the cervix. With the First Lady of the Federal Republic of Nigeria, Patience Goodluck Jonathan, helped us to flag this off and also to close it when we first introduced it to the public sector. Now, a number of hospitals are giving this, and even private hospitals are giving this. Now, even if you have to pay to get the full cost, can never be more than 5,000. So all you need to do is reduce the amount of money you spend on talking on the phone. Send a lot of text instead of talking on the phone all the time. Save money and enjoy your daughter, your niece, all the people that are eligible for immunization are from 9 to 15. So you need to do that. Then we have established screening centers because early diagnosis is important. Now, all our hospitals, all federal hospitals can screen. But the federal government decided to establish, for now, 6 special mass screening. The screening is free in these hospitals. I'm going to list out for you. University of Port Harcourt Teaching Hospital, Port Harcourt. Federal Medical Center, Guzo. National Obstetric Fistula Center, VVF Center, Abakaliki. Federal Medical Center, Kefi. Federal Medical Center, Ebutemeta. Abuaka Tafawa Balewa Teaching Hospital, Bauchi. We are going to establish more. But these ones are free, they are mass. And even private hospitals are also now offering that free of charge. Loot and lack of bed space. Loot is supposed to be a tertiary care hospital for specialist care. But sometimes, just like what the Minister of State for Education was telling us, when your local government, you don't challenge your local government chairman. When they don't provide primary health care centers that are functioning, everything you have, ordinary malaria, you are rushing to loot because that's where it is functioning. Of course, people always go where it is functioning. We have 800 beds in loot. People fill it up. Now, if it's ordinary business, you say, well, as more people bring a cloth to the tailor, it shows how good the tailor is. It shows that loot is good. Otherwise, we'll be having empty beds. Loot is good. But what we are saying now is that other people should complement. If we do our primary health care centers and it works, primary health care center will take off 90% of patients. Then the general hospitals, some state governments are trying on this. General hospitals which the state government should build, that will also take out some more. Then private hospitals are also establishing their own teaching hospitals and their own specialist centers. But we'll continue to increase. Recently, we built a new pediatric ward in Lut. These are efforts we are making to expand the bed space. Then, VAMED projects. What is the position? The position as of today is that we want to move into the third phase. We have done the first phase, which covered 8 hospitals. I won't want to bore you, but including University of Port Harcourt Teaching Hospital, University of Maiduguri Teaching Hospital, Ahmadu Bello University Teaching Hospital, Jos University Teaching Hospital, University of Ilorin Teaching Hospital, UNTH, UCH Ibadan. Usman Danfodio University Hospital was commissioned by President Jonathan. You people watched it. Aminu Kano Teaching Hospital have been commissioned by President Jonathan. You people watched it. 2 have been functioning, but they are waiting for President Jonathan to just do the official commissioning. The one in Benin, the one in Ile-Ife, and the 2 that will be completed this year, the one in Atinewi and the other one in Calabar. That is the stage. They are working. Go there and see for yourself. Then National Health Insurance Scheme and NYSC. Well, this is a scheme we introduced and it's working well. We also have one for university students. Many VCs have, and their councils of the universities have bought into it. There are times when people complain and we say, okay, fine, let's look into your complaints. So there's presently dialogue between the National Health Insurance Scheme and NYSC. We'll bring it back. It's working. Then, I think I've answered all that. My Minister of State will answer the many ones.
So may we invite the Minister of State Health to answer just within 1 minute.
Well, thank you. I think I'll just mention 3 things. First is that you get the health system that you finance. The amount of money you put into the health system, if you want an expensive health system, you have to put a lot more money. Both federal government, states, but also individuals. I think as Nigerians, we spend more on mobile telephone charges, credits, than we actually spend per capita on health. So we have to reflect on that. The issue of health insurance is key. I think it's still work in progress. I don't think we've really cracked it. But it's something that collectively we have to fix. If you're funding a health system per capita, $100 per person on health, you can't get the quality of health that you will get if you are spending $1,000, $2,000 per person. So you get the health system that you finance. Secondly, on the issue of population, I think the gentleman who raised that question is one of the most important issues, both for health and education. There's a reality that in the next few years, our wealth as a country will not be barrels of oil, but will walk on 2 legs. This is the people that we have, the youth that we have. And the dependency ratio that we have as a country has remained stable for almost 50 years. We compared Nigeria and Indonesia. Over 50 years, the dependency ratio was the same in Indonesia as Nigeria. By 1980, Indonesia has changed. Nigeria has remained the same. And coincidental to that, economic development took off. What am I saying? It's not the absolute number of population. China has a lot of people. India has a lot of people they've developed. America is twice as they've developed. But it's a dependency ratio. Because if you have a large dependency ratio, then you're not able to invest in nutrition, in health, in education for the economic development. You are not able to save as well as you should. But how do you deal with it? It's not an issue of religion. Because some Muslim countries or Christian countries or Catholic countries have much lower fertility rates than some other countries. Even in this country, across the country, if a woman is educated, she's more likely to have lower fertility rate regardless of her religion. So it's issue of girl-child education, but also beyond primary education, post-secondary education, and length of education. That's one aspect, and I think that's where the Ministry of Education is important. We have to focus on educating our girls. Child literacy, girls, educated women have lower fertility rate in Nigeria, are able to have control over their reproductive rights. They're able to negotiate, they're empowered, and that's important. The second element is that of what Mr. President is trying to do about women empowerment. He said his 2013 budget is about women. And that idea, you cannot develop with half your population totally unempowered. And for a country like ours, we have to find a way to engage on that. And then finally, for the health sector, the reproductive health commodities. Family planning, for those who are voluntarily willing, they should have those services. We have unmet need of contraceptives, almost 70%, because the commodities are not there. Women want to use it, but they cannot get it. So every woman who wants to control her fertility should have access to do that. That's what Mr. President announced at the Family Planning Summit in London. And I think we should make those available through our facilities, through our financing mechanism, and we are doing that, and it's part of the scorecard that we presented. So 3 elements: education, empowerment, and reproductive health access. No point to save a woman when she is about to die of high number of pregnancies, and you cannot provide her the opportunity to choose when she wants to get pregnant. But it's a choice that has to be right-based. Individuals and families must make the choices as to how they want to run their lives. Finally, another person asked a question of strongyloides and other parasites. These are what they call neglected tropical diseases. Well, as I say to a lot of people, they are not really neglected tropical diseases, but they are rather diseases of neglected people. We have millions of Nigerians in rural areas, in farming communities that have these parasites. But they are really out, they're not in Abuja, they will not be sitting here at the ministerial platform. And I assure you, the people in my village may not even have the television or the Twitter or the paper to hear what we have discussed. But they're also Nigerians. Many of them have those parasites. These are neglected peoples. So the Ministry of Health launched a master plan for dealing with neglected tropical diseases or the diseases of neglected people. It costs money. And I think right now we're trying to raise those resources so that over time we'll start to deal with schistosomiasis, with strongyloidiasis and other parasitic infections that have been neglected for a very long time. Thank you very much.
We thank the Honorable Minister of State Health for his own answers. And quickly, Honorable Minister of Health, the adult population said that they are the most vulnerable group. Please extend the diabetic-free treatment to them. Thank you.